Their names do have glossus in the end. I am not going to require you to know them, but remember there are three very important muscles that are part of your tongue. So that was the buccinator, the masseter, the temporalis, and these are the glossus muscles, okay? So you have one here that connects here, and then another one here, and another one here, okay? 3. So it's 1, 2, and 3, but I'm not asking you that. There are many tables that I'm just skipping as we go, and as you look at these tables, you see how I put the origin and insertion in gray. I still want you guys to see it, even though I'm not gonna ask you, okay? Okay, neck. Neck, important in our list. Sternocleidomastoid, which is this here, connects to the mastoid process in your school, remember behind your ear, to the xiphoid or xiphoid process, sorry, I'm talking Portuguese, of the sternum, and to the clavicle. Okay, that's why it's called sternum, clavicle, and mastoid process. That's the name of this muscle. Responsible for moving your head side to side and forward. How can the same muscle do two very different movements? If you use only one sternocleidomastoid, when it shortens, you're moving the neck to this side. If this shortens, and I can feel it, moving the neck to the other side. When both shorten, moving the head down. Make sense? So it's flexion of your head and lateral rotation to both sides, okay, depending on which sternocleidomastoid, right or left, you're talking about. The scalenes are responsible for elevating ribs 1 and 2. So this is rib 1, this is rib 2, and look where they insert, in the ribs. So there are 3 different scalenes. You don't need to know which one of them. Just know that the scalenes are responsible for elevating ribs 1 and 2. Why do you elevate ribs 1 and 2? When you're just regularly breathing at rest, you actually don't so much, but when you do a forceful inspiration, you see that elevating, then you do it. Okay, then you elevate these 2 ribs. The other ribs are always elevated when you breathe, and we're going to talk about those muscles in a minute. There is another muscle that is the sternohyoid that depresses the larynx and the hyoid bone. So it's a muscle involved in swallowing. I did not have a picture of it here, but it has a picture in your book. So make sure you go in your book and you look at the sternohyoid. There are other, remember the hyoid bone is here. Let's show it in a picture. This is the hyoid bone, right? It's a bone that is not really connected to any other bone of your body, just connected to muscles. And this bone is a site of attachment for many different muscles related to tongue movement, neck movement, and larynx movement during swallowing, okay? Like the sternohyoid, connects to the sternum and to the hyoid, and it moves your pharynx up, down when you are swallowing. Okay, I think we're ready to move to the respiration muscle. So now we're in the third part of our table that says shoulder, anterior thorax, and I included in anterior thorax the muscles of respiration. So here you have the external intercostals. So they are outside of the ribs. And then here on the inside of your ribs, in the interior part, you have the internal intercostals. These muscles both move the rib cage. The difference is that these make the rib cage elevate and open. And so it's when you inhale, you use the external intercostals. When you exhale, for you to close back the rib cage, it moves all these muscles back down. So it pushes the ribs down, internal intercostal. So this you move down, and this you move up. Why do you move up? To open, to expand, so your lungs can expand and you can inhale air. Make sense? There is also another muscle related in that movement, which is the diaphragm, right? Which divides your thorax from your abdomen. The diaphragm is very strong muscle. It's also a skeletal muscle, and when it contracts, when it's flat, contracted, is for you to inhale. And when you relax, if it gets dome-shaped, your rib cage decreases size. That's when you exhale. Okay. All right. I think we are ready to give a stop here. I will see you in video 2 when we talk about abdomen, thorax, and shoulder. Bye bye.